my name is Dr. Nicholas Meyer. I practice in Scottsdale, Arizona in the field of holistic biological dentistry. And I'm here today to talk to you a little bit about one of the areas of our practice, which is heavy metal detoxification. So what does that mean to you? Well, most of the time it means the materials that are in somebody's teeth, such as mercury fillings or incompatible materials such as gold and mixed metals, where we have mercury next to gold, or we have non-precious alloys against precious metal alloys, and how they all interact. Well, with respect to the area of heavy metal detox, it's one thing for me to go in and remove the noxious materials from somebody's teeth. It's another thing to say to the individual, so you've had these fillings in your mouth for 40 years, so you've had 40 years worth of dumping of the mercury content or other materials that are in your mouth into your cellular tissues. Well, that's another challenge then, to have that extracted out of your body, not just me removing or extracting the metals out of your mouth. That can be done relatively easily, but the detoxification process through chelation, for instance, is a much longer, slower process, because that stuff is bound tightly into the tissues, and you need some additional help, usually in the form of some either natural agent like vitamin C, or pharmaceutical agents like DMPS or glutathione and things of that nature to help extract that out of your body. Now, the process of having that done is lengthy, and one of the things I feel strongly about is that you have that medically managed. It's something that's not just to be done on your own, although I'm a big advocate of consumer-led healthcare or doing things on your own. There are certain things not advised to do on your own. So the utilization of properly trained doctors of whatever type that are out there to help you safely remove the heavy metal burden that your body has. And that can be measured through the likes of hair analysis, urinalysis, or blood tests. And that way you have some idea of what your body burden is, how are you doing through the process, and then when you are thinking it's 6 months or a year down the line from the process when you've started, have another test and see how you're doing. Because if you're not gaining, either your dosing is wrong, or you're barking up the wrong tree with the agents that are being used, or something else is going on. So those are just kind of a broad brushstroke view of heavy metal detox from my point of view. I've been doing this kind of work for many years, and we do use vitamin C during the time of the removal when we have it available for people if they're open to that. It's certainly not mandatory in our practice. It's highly recommended for people, and certainly the sicker somebody is, the more we kind of really recommend it for somebody. That is a really big part of a wellness packaged, or a plan of attack for having your body better taken care of through the removal of the noxious materials that are in your mouth.